Medical training is challenging. From medical school to residency, potentially fellowship, there are lots of exams, call shifts, and notes to write. And yet, books alone do not shape clinical reasoning, bedside manner, or professionalism. The future of medicine is in the people, which makes encouraging and equipping medical students and physicians still in training so important. Join me for the rest of today's episode for some ideas of how to invest in the future of medicine. Welcome to the Med Ed Well podcast, where physicians get empowered to take the next step in their wellness, personally, professionally, and financially. I'm your host, Dr. Ryan Stejink, a practicing general pediatrician and online entrepreneur. Thank you so much for joining me here on episode 31 of the Med Ed Well podcast. Thank you so much for listening, for sharing, and for subscribing to the podcast. If you're looking to increase your efficiency, to get work done sooner so that you can support your wellness, check out Maximize Your Clinical Efficiency, my free PDF guide to help you get stuff done. You'll also get on my email list where you'll get reminders about upcoming episodes and additional brief stories or reflections related to the episode. Today, we'll be talking about encouraging trainees, medical students, residents, and fellows, going through a bunch of the hard things that they face. And we'll talk about how each of us can encourage and build into others earlier in their journey than we are. But before we get into the rest of today's episode, let's hear from today's sponsor. Getting a financial education seems daunting until you realize that you did way harder things in medical training. The White Coat Investor has been promoting financial literacy for doctors since 2011 and has great courses to help you make a financial plan, evaluate financial advice, and pursue your wellness. CME is included on some of the courses, making them a perfect fit for those unused professional funds. I have personally taken the Fire Your Financial Advisor course and found it super valuable in my own financial education. I encourage you to visit the link in the show notes and consider signing up for a White Coat Investor course today. All right, now back to today's show. Looking back on what is now more than a decade since I started medical school, I think back on how many hours I spent studying, preparing, exam questions that I took, notes written, and shifts completed since I started. It was challenging. A lot of hard work. Rewarding in the end, yes, but difficult. I couldn't do it all on my own. People made such a huge difference for me. Third and fourth year medical students helping this first year with vital signs and history taking. Pediatricians willing to give lunch lectures or be on panels to share about their experience as a pediatrician or pediatric specialist. Faculty mentors who told me that you need to love the patient population and general problems that you will address on a regular basis. A department head who walked me through changing my schedule in the midst of burnout. Regardless of where you are in training or after, you can probably identify a few people who have had a lot of impact on you and your career. Today, we will talk about a few ways that you can encourage trainees and shape the future of medicine, covering both points of contact and then input that is needed. So the first area, encouraging and interacting with trainees. The different points of contact and opportunities to be involved. First opportunity is in precepting. Whether it's medical students, residents, or fellows, it could be a regular thing, or it could be intermittent. It could be a continuity clinic. Maybe it's 1 to 2 residents rather than 3 at any given time. In my clinic, I've had opportunities to cover for my colleagues, and 3 at a time is particularly challenging, both for the patient care and providing the education. And I have a lot more respect for those who do it and do it well. Next, lectures. You could talk about a medical topic, about burnout, about finances. I gave one on finances that was well received, and that was part of why I ended up starting this podcast. You could also be involved in simulation days. I had a simulation elective in residency, but anyone with clinical experience could assist the simulation team. Depending on where you trained or the programs available in your city, they may be looking for volunteers. Next, mentoring. It could be one-on-ones structured or just kind of an ad hoc meeting. You could go and support a group. Maybe it's a primary care interest group. There were dinners that a group at my residency had that was really helpful for me, getting to hear the perspective from both early and later career pediatricians. You could also get involved in program leadership, whether for the residents, for the fellows, maybe the clerkship for the medical students. You can choose which of these that you want to engage with. But don't let imposter syndrome keep you from stepping out and trying something just because you are comparing yourself to someone else. So first, there are the opportunities or points of contact with trainees. But then second, and more importantly, what input do they need? First, they need good clinical role models. Not only looking at content and medical knowledge, but then illness scripts and how you approach particular chief complaints or disease states. They need examples of how to craft a differential diagnosis, how to prioritize things, what are the most common and what are the most dangerous, and what else you might be missing that might be lower down if something else came out later in the investigation. They also need to see your thought process, clinical reasoning, critical thinking. These are important skills that have to be learned. And if no one teaches you, they're very hard to pick up. Trainees also need examples of good communication. It could be motivational interviewing. It could be communication of the day's plan. I talked about how some of the attendings on my developmental pediatrics rotation really gave me some good feedback that helped shape how I do family-centered rounds and instructions. It could be how you consent patients for a particular procedure, making sure that they are able to understand and properly weigh the risks and benefits of that procedure. Trainees need to see examples of how to give bad or unexpected news, and how to do that in a way that conveys empathy and compassion. They also need examples of communication with staff and colleagues, consultants. Additionally, they need examples of how to care for yourself and for others at the same time. We've heard so much about the patient comes first, but if you aren't caring for yourself, you can't then have a long-term ability to care for others. And maybe it's modeling these things by letting someone go home early because something's more important for life. Maybe it's letting them go to an urgent medical appointment, or maybe it's letting them miss most of clinic because the rehearsal dinner was that evening and it's out of town. I said, this is much more important. I can tell that you already have the developing clinical skills to show that you will do just fine in your career. You need to go. A big part of this is being aware and flexible when these situations come up. So not only is it caring for your own wellness and modeling it, but also talking about it with trainees. It's really important. Because without self-care, in the long run, you will lose your ability to effectively care for others. When students and residents come to work with me in clinic, I usually ask what's their plan for their career. Do they have a plan for their student loans and for getting disability insurance that's true own occupation while they're in residency or fellowship? Not in med school, but while they're in training as a physician. There's typically guaranteed standard issue policies and often unisex and other discounts available. It's also important to share with trainees questions that they would want to ask of potential employers, or how to negotiate, since you can't have a chance to have the things you want if you don't ask for them. It's also important to talk about choosing career options consistent with your priorities. It may be having the ability to cut to a lower FTE, maybe going part-time. It's important for them to ask when the benefits kick in, and maybe at a different threshold. Some employers will say that if you're 3/4 time, that's still considered full-time. Or maybe if you're at least 0.5, then you could at least get health insurance. So these things may be unique to a particular situation, but as more and more of us talk about these things with trainees, they'll be more equipped to handle these situations once they get out of training. And these definitions of full-time not only affect benefits, but also for loans and loan forgiveness options, whether National Health Service Corps, Public Service Loan Forgiveness, or something else. So I want you to take a moment, stop what you're doing, and reflect. What kind of impact do you want to make on the next generation of medicine? Your future colleagues, the physicians and medical professionals who will be caring for you and your family? Imagine if you took one or more of these opportunities to engage, to mentor students or residents, to take the extra few minutes to explain your clinical reasoning more fully, to give a lecture on that topic that you really enjoy. How would you be remembered? Your impact multiplied by the time that you retire from medicine. These are individual lives, people, physicians and patients that you have the privilege of impacting by your choice. Reflect on where you are currently involved with trainees, if you like where that trajectory is pointing you, and then commit to taking your next step today. Thank you so much for joining me here on episode 31 of the MedEd Well podcast. Please subscribe, share these episodes with a colleague, and review the podcast if you haven't already. Make sure you get your free guide to getting things done at work. Go to mededwell.com/efficiency guide. Today's sponsor is the White Coat Investor courses. So if you're looking for some CME and need a course, check one out today. Again, thank you so much for all that you do. Have a great day. And now for our important disclaimer. Dr. Ryan Stejink is a practicing general pediatrician, but the MedEdWell podcast does not reflect the views, opinions, or belief of his employer nor his affiliated university. Additionally, the MedEdWell podcast is for educational and entertainment purposes only and should not be considered advice regarding financial, legal, student loan, medical, or any other specific topic. In such a case, you should seek consultation with a certified professional in that particular area. Again, thanks for joining us on the MedEdWell podcast, and have a great day.